This is Dr. Kasbarian here at Pediatric Associates of Austin. I want to address an issue that we've been getting a lot of calls about lately, specifically about blood types and infection with COVID-19. You might have seen in the news lately that there was a recent article that has been released, not yet published, about certain blood types and susceptibility to severe respiratory illness with COVID-19. I want to stress, one, that this is just a single study that has been pre-published, meaning that actually it hasn't gone through the rigorous process of peer review yet and has not been final published. However, there is some data that the study shows that there is a relation between certain blood types and only specifically looking at severe respiratory illness, meaning hospitalization, intubation, and potential death if you do get infected with COVID-19. This is a study that comes out of Italy and Spain and actually looks at older adults. So the youngest person in this study was actually 54. So just keep that in mind whenever we're addressing our pediatric population here. But the study actually showed that people with type A blood type actually seem to be a little bit more susceptible to getting severe respiratory infections and illness, rather than actually type O blood type tended to have more of a protective effect. So what does this mean for you and for your child? Well, one, let's first address what exactly are blood types. Blood types are genetically determined. There's four main categories, which are type A, type B, AB, and O. And B's are, like I said, genetically determined, and we also have a positive and negative value that is assigned as well with them. And basically what they are antigens that are receptors that are on each red blood cell that gives them that typing and also allows your body to recognize it as its own and as self. So next you may be wondering, well, how do I know what my child's blood type is, or even my blood type? And the short answer is, well, you probably don't. For the general healthy population, most of the time we do not routinely do screening in order to determine what our blood types are. Only in certain medical indications will we actually do the lab work that's necessary to figure that out. Usually these things are if we've ever gotten a blood transfusion or had the potential for the need of a blood transfusion, sometimes with high-risk surgeries. You might also know if you've ever donated blood before, they'll often let you know what your blood type is through that. So remember that even though you may not know what your blood type is, or maybe you do know what your blood type is, this doesn't actually change what our recommendations are and how we would even act even if we did get a COVID-19 infection. Because really the study showed that even people with type A blood type sometimes did really well and had no serious infections or illness at all. And there are also the type O blood types that did have severe respiratory illness. So it doesn't mean that you're susceptible, like more susceptible or less susceptible even regarding that, even to actually getting the infection either. So that's why we recommend that everyone still take the precautions, because everyone is still at risk from getting infected and from disease from COVID-19. And so we still recommend that you continue to practice your social distancing measures, continue to wear your mask whenever you're out in public, and continue good hand washing techniques and practices as well. And remember, here at PAA, we're always here for you. If you have any other questions, concerns, or even if you do get sick, we're always here for you. Just feel free to call us.